everyone, Justin White here, CEO of Senior Health Services, and thank you so much for watching. First off, this is Thanksgiving week. I want to wish everybody a happy Thanksgiving. I hope in however it is that you celebrate that you have a really good one and be safe while you're out there. So, Medicare supplements versus Medicare Advantage. Now, that is admittedly a gigantic topic, and I'm going to have to do some more on that in the near future, but I want to give you a quick overview because this is oftentimes a real big sticking point for people. And if you're watching online and oh my gosh, the amount of information that you get usually is more confusing than not. So Medicare supplements have been around for decades. It's probably what your parents or grandparents had in the past. And you know that that's what they had. You can say, well, my mama never paid anything for anything. Your mama had a supplement. In all likelihood, that's how you describe those. And you'll have a letter name. They're like Plan, back in the day it was Plan F or Plan C. Now it's Plan G or Plan N, generally, the two most popular ones. And those pay the Medicare 20%, what Medicare covers and approves but doesn't pay, that 20% is what the supplements do. Okay, that's what they pick up directly, and how much of it they pick up depends on which supplement you have. Okay, so that's the supplements. Now, you also do not have to have a primary care physician, and you've got the most flexibility and freedom to go wherever it is you really want to go. Really, all your only criteria as far as network goes is does the doctor that you want to go see take Medicare? And if they do, you can go regardless of where you are in the United States. They all work the same, and people like that. Now, there's also a premium on those on the downside, and that premium generally goes up every single year. So you're getting the convenience of not having to get referrals and things, and the flexibility and the more robust travelability within the contiguous United States, but you're also paying for that privilege, if that makes any sense, okay? And then because Medicare, original Medicare does not cover prescription drugs that you'd pick up at CVS or Walgreens, we have to add a drug plan, okay? So the folks who like those are folks that want control, and they want to be able to make decisions a little easier and a little bit quicker. And they also want something that doctors tend to prefer. I would say more, if I asked 10 doctors, probably 8 or 9 of them would say, yeah, if you can afford it, get the supplement, right? So those are the folks that come down in that camp, okay? So if that's you, and people fall definitively into one of these camps, then you might be a supplement person. On the other side of the Advantage plans, and these are the HMOs and the PPOs, and there's some other types of them, but those are the two primary ones. More people take the HMOs than anything. These are the ones that the commercials are usually talking about when they say, well, the commercials running at all, and most of the mail, and those are the ones that say, as low as $0. That's true. However, there is a premium. It's just not you paying it. The government's paying it, okay? And they are indeed zero, okay? Now, people look at that and they're like, well, that's really good. What's the catch? They must be terrible, whatever. When people complain about an Advantage plan, it's because they have to get referrals sometimes in the case of HMOs, and also pre-authorization and things like that, okay? The doctors will get annoyed with Medicare Advantage because they have to jump through a few more hoops to get some procedures approved, etc. But you know what they kind of feel like? And this is a loose analogy, but they kind of feel a little bit like the group insurance that you had when you were working or have now. So if you love that, then the chances are that an Advantage plan might feel pretty good. And people like those because of that zero premium. You'll be paying the Part B premium, which next year the standard is $185 a month, taken from your Social Security or billed quarterly if you're not taking it yet. But that's all you pay until you get to services or procedures that have a copay or a coinsurance. Okay, so you're like, well, that's what we're doing right now, because you'll pay that only up to a maximum out of pocket. The drug coverage is baked in, and then they have extra stuff like dental and vision and other ancillary things so that you don't have to be sick in order to get something out of that plan. Whereas on the supplement side, you got more freedom and flexibility, but you kind of have to be going in for a procedure, a doctor visit to be able to do anything with that. Make sense? Okay. So the Advantage plans, yeah, you're trading some freedom and you're trading some flexibility, but you're also getting some stuff that original Medicare doesn't provide, like the dental and the ancillary things. And as long as if you trust and love your primary care physician, and you're probably getting referrals now, then, and you're like, well, I'm doing that now, and I like that, and I really like the idea of not having to pay anything else, then you might be an Advantage person. But people fall squarely in one of those two camps, and both are right for them. You're right for you. If you're sitting there going, I love my Advantage plan, you're right for you. Somebody else go, I'd never take Advantage, I love my supplement, they're right for them. And that's the first thing that we do at Senior Health Services, to figure out who we're talking to so that we can place you in the right plan from the get-go, because if you get in the right plan from the get-go, you're going to be generally very happy with your Medicare. That's Medicare Monday, folks. I hope you enjoyed it. Have a great day, great Thanksgiving, and we'll catch you next time.